What are hemorrhoids? What are they caused by? Are they serious? How can we get rid of them? Or do they go down naturally? Hello and welcome back to Dr. Solar channel. I am Dr. Fatima, and in today's video, we're gonna answer all of your questions about hemorrhoids. And guess what? It's gonna be all based on latest published medical research. So stay with me until the end of this video and let's go. Many of us experience having hemorrhoids at some point in our lives, and they are essentially swollen veins around anus. And these veins can fill with blood, leading to symptoms like bleeding, pain, and sometimes the formation of a lump or mass. There are two types of hemorrhoids. The first one is internal hemorrhoids. These ones are mostly inside your rectum, so they don't have so much pain, but most of the time you have bleeding. The other type is external hemorrhoids. These are mostly found under the skin around your anus. These can be quite painful, especially if they form a blood clot, known as a thrombosed hemorrhoid. A thrombosed hemorrhoid can appear purple and cause significant discomfort. Now let's talk about who can get hemorrhoids. Actually, everybody can get hemorrhoids, but it's not really common among children. But as we age, the chance that we get hemorrhoids increases, and by the age of 50, around 50% of us experience hemorrhoids. And that is mostly because as we age, the tissue supporting our veins around our anus and rectum can weaken and stretch. Another group of people who are more prone to get hemorrhoids are the ones who are pregnant. In pregnancy, the pressure in the pelvic area is increased, and this increased pressure in combination with some other factors can lead to hemorrhoids. Now, if you have chronic constipation and you have to strain a lot during your bowel movements, this can also put a lot of pressure on your veins and cause hemorrhoids. Now, let's talk about the most important part. Let's consider that we have hemorrhoids. What should we do step by step in order to get rid of it? The first step is improving your lifestyle. Make sure that you put enough fiber in your diet. Go for 30 to 40 grams of fiber every day. You can get this much of fiber through whole grains, fruits, vegetables, or supplements like psyllium. Fiber softens our stool and reduces the need for straining. You can include a serving of bran cereal for breakfast, add beans or lentils to your lunch, and snack on fruits like apples or pears. The other important point is to make sure that you drink at least 8 glasses of water every day. You can take a water bottle with you everywhere you go just to remind you that you have to drink enough water every day. When we drink enough water throughout the day, it helps preventing constipation and keeps our stool soft. Another very important point is to go to the bathroom only when you feel the urge and avoid straining during the bowel movements. If nothing happens during a few minutes, it's better to get up and try again later. So try to limit your toilet time and make sure that you don't stay in the toilet more than 5 to 10 minutes in order to reduce the pressure on your anal veins. Exercise like swimming or walking about 30 minutes 3 days a week can help you a lot as well. Now you might say, I've done all of these and my hemorrhoids are still there. That's where we get to step 2. Now, before we start talking about step 2, I wanted to ask you guys a quick favor to give this video a thumbs up if you liked it so far and subscribe for more videos like this. It really helps me and keeps me motivated for making more videos like this. All right, jumping to step 2, using sitz baths and cold compresses. Soaking your anal area in warm water for about 10 to 15 minutes several times a day can significantly reduce the swelling and discomfort of hemorrhoids. Another thing that you can try for reducing the pain and swelling is using a cold compress for a few minutes several times a day. Now, if you've already tried these 2 steps and you still don't feel better, it's time to see a doctor. A doctor will discuss your symptoms and your risk factors and will do a rectal examination. Based on your symptoms and your risk factors, your doctor might offer you further examination with endoscopy or colonoscopy, or they might offer you some treatment options. In endoscopy, a small tube is inserted into your anus in order to visualize the inside of your anus. This procedure is mostly done for internal hemorrhoids and is an easy and quick procedure done at doctor's office. But sometimes a colonoscopy is recommended to rule out some other conditions like colorectal cancer. If you have significant bleeding or you are over 50, there is a high chance that you need colonoscopy as well. Now, after all of these examinations, your doctor might offer you with some suggestions, and one of them is hemorrhoid creams. These creams usually have medications like hydrocortisone, which helps reduce pain, itching, and inflammation. After a few days of using these creams, you mostly notice some change. But if your symptoms worsen or persist after a week, it's time to talk to your doctor again. And that's where we get to step 4. You might need minimally invasive surgeries. One of these procedures is called rubber band ligation. In this procedure, rubber bands are placed around the base of internal hemorrhoids to cut off blood supply, and this causes them to shrink and fall off. Now, if you have a smaller internal hemorrhoid, your doctor might suggest sclerotherapy. In this treatment, a chemical is injected into your hemorrhoid in order to shrink it. There is also infrared coagulation, where infrared light is used to coagulate the blood supply to the hemorrhoid. All of these 3 procedures are minimally invasive and can be done in doctor's office. But there are some other surgical options which are suggested for more severe and persistent hemorrhoids. And here we go, you have all the information needed about hemorrhoids. Let me know if you've ever experienced hemorrhoid, and if yes, in which step, and what did you do to get rid of it? Thank you guys for watching until the end of this video. Don't forget to like and subscribe, and I can't wait to see your comments about your experiences with hemorrhoids. Until the next video, bye!